Health Skills and Knowledge Framework. Today is being webcast, so I would like to not only welcome those of you that are in the room, but also those webcasters. It's really nice to see so many of you interested in what we're going to be exploring and discussing further this morning. And also that I'm looking around the room seeing lots of familiar faces, but also faces that are not familiar to me. So, and in that regard, I should introduce myself. I'm Michelle McCoy, and I'm currently Joint Interim Director of Public Health in Dumfries and Galloway, and I'm also non-executive board member at NHS Health Scotland. When this event first came to my notice, I actually put down my name to attend, so therefore was expecting to sit somewhere amongst where you all are. So, and then found myself here. But I'm hoping that we will have opportunity to get together and explore and discuss, and I will be able to move across into that part of the room today. I'm going to set the scene just a little bit, but I need to do some of the practical housekeeping stuff, so I'll run through that list. First, can I just ask you just to make sure that your mobile phones are on silent? As we know, there are microphones, and I've just said that people are webcasting into this. So there are microphones around the room to help, particularly the webcasters here, but we've just realised it's actually helping all of us. We're really interested in hearing comments and discussions as we go through the day. So if you would please use the microphones when you do that. I would also like to encourage you to use the Twitter hashtag, which I think is around the room, but it's #PublicHealth. There is no planned fire alarm this morning. So should the fire alarm go, it's a matter of exiting out of this room through the doors you came in, and one of the fire exits is actually the way out the door we came in, and there's another one over, I think, that side of this to our right, and I understand the meeting point is at Central Station Hotel. So now I think we've got that to visit the housekeeping. More into the programme, there are opportunities for coffee and lunch is scheduled. So there's plenty of chance to move around, but I would like to suggest that you also take an opportunity to stand up or move around at any point that you feel. This room, it's a great room. It gives plenty of space for that. So don't feel that you have to sit for too long or feel uncomfortable sitting. So back to the purpose of us all being here. For some of you in the room, this framework will seem familiar, and for others it will be new. But the aim of this and what we're wanting to do is to support skills and competencies across the public health workforce. Public health work, as we know, it's broad, and it's about improving and protecting the population's health and also working to reduce health inequalities. It's complex and it's challenging, and I don't think I need to be telling you that, but it's just a bit of a reminder all the time. This is not something simple that we're doing. Working in public health requires a range of skills, whether it's working with the data, when that might be collecting the data, analysing it, interpreting it, whether it's developing policies, strategies, or whether it's delivering action. But all of these things require specific sets of skills and competencies. We're all about improving population health and well-being, whether it's with individuals, communities, across services, making them accessible, looking at the infrastructures, our environments. Do we make healthy choices, the easy choices? And I think it's really important to remember that any action that we undertake by working in public health has the potential to impact on individuals and communities. It's so very important that that impact is positive and that it contributes to the desired outcomes. I believe it also needs to be safe and effective. Today is about launching in Scotland the revised Public Health Skills and Knowledge Framework. And the purpose of that is to support high standards and good practice. This is part of a journey which began for some people, some of us in the room in 2008, and it was the publication of the first UK framework. And then in 2015, NHS Scotland engaged stakeholders as part of a UK-wide consultation to inform the review of that 2008 framework. It's a collaborative effort and has involved not only NHS Health Scotland, but Public Health England, Public Health Wales, and the Public Health Agency for Northern Ireland. Today is an opportunity for us to collectively to consider the framework and what that means for Scotland. The programme gives opportunity for us all to learn more, to reflect, but also to inquire. The review of public health in Scotland recognised the need for a really strong multidisciplinary workforce for public health. And that's a recognition of that complexity that I was referring to earlier. The landscape of public health is also changing at the moment, and quite rapidly. There are many challenges that we face for public health in Scotland. We've got an ageing population, we have inequalities, we've got a changing political landscape, we've got health and social care integration, and you will be able to think of more. We need that strong workforce. Having had a quick look at the delegates here in the room, I personally am delighted to see that there's such support and interest in this multidisciplinary workforce that we need going forward. It's a great programme. We've got a variety of different insights, some information about what has gone before, work that's been undertaken, what the thinking has been, but also an opportunity to hear various reflections from people. So I think that brings me to handing over to Andrew Fraser, who is going to begin with the first presentation. And Andrew is Director of Public Health Sciences at NHS Scotland and also Chair of the Directors of Public Health in Scotland.